Hi, my name is Stephanie Thibault. Jillian's my daughter. Jillian just shared some really special news with me.
I've received the Shining Star Award for the HCA and part of being the Sepsis Alliance organization.
Extremely proud of this accomplishment for her. She's really put a lot of effort into, helping other people. Her contribution that she tries to with home health care is, I think, a benefit to so many people and a benefit to her as well because it keeps her focused on things other than her illness. Jillian had her gallbladder out in between her junior and senior year of college, where she was playing college softball. 3 months later, she developed what's called gastroparesis. She couldn't eat. Gastroparesis is essentially paralysis of the stomach. Many individuals that are afflicted with this do quite well with diet modification. Unfortunately, with Jillian, that wasn't the case. Her symptoms became pretty severe very quickly. We went from feeding her through a J tube, where she was which goes into her intestines, and that no longer was an option. So now she has a central line up here for her nutrition, and she hooks herself up to what's called TPN. The TPN is based on what her blood work shows that it needs to be. They basically take her blood, and then a pharmacist creates her TPN for her based on what her body is lacking at the time. So fortunately, the good thing about having a central line, it's kept her alive for 11 years. The unfortunate thing with a central line is that it's a breeding ground for infection. The area has to be kept very sterile, clean, and also the feeding that goes through this central line is very high in sugar, which is also a breeding ground for bacteria. So Jillian has had her bouts with, she's had several bouts of sepsis. Fortunately, she has become so aware of her body and how her body reacts to infection that she knows when it's time to go to the hospital. When we get to the ER after reviewing her history, they pretty much, even though her blood work may indicate otherwise, they start to treat her for infection by antibiotics, IV antibiotics, sometimes a broad spectrum and an additional one. They immediately do blood cultures so they know what bug they're dealing with. For the people that aren't as aware of their bodies like she is, sepsis, this infection can progress much quicker and much farther along than it does for Jillian because she's aware. She develops, she'll spike a fever. She knows how she feels. She develops Riger chills, and she'll say, okay, it's time to go.
I think that helps me in kind of
mitigating
others,
the fact that, they might be able to treat the infection prior to advancing into sepsis or septic shock. So she's really taken a great interest in helping others, helping home care providers. Where would we be without our home care providers and her nurses that come and visit her on a weekly basis?
And just being around everyday people like family and friends and your nurses and stuff, and
yeah.
It's priceless.
It's very hard when you go from an extremely active young lady who is in college to becoming so ill that you can't work. So this has been a tremendous thing for Jillian as well, to be a part of something and to feel needed.
Sense of accomplishment.
Yeah. So I'm very proud of the work she's done and her care and concern, and I'm happy that she got recognized for this. So I'm very proud of you.
Thank you. I wouldn't be anywhere today without you. I can promise you that.
So
we thank you for this.
Thank you for listening.
Opportunity and this award, and for listening.
Thank you.
Thank you.